to Scottish Planner Live. What would previously have been the Scottish RTPI conference has been transformed
Irene, really sorry to interrupt. Just turn that microphone up a little bit more, please.
Okay, is that all right? Okay, doc. Normally get told I'm too quiet for sure. So as I say, the old previous RTPI Scottish Conference transformed into 10 short online events that will be running over the course of this week. Our topic for the whole of the week will be how we plan for healthy places, something that's very much in the heart of what planning has been about for decades, but with a fresh emphasis on it, given what we are going through with COVID, an emphasis on place and on our health and on what we can do to change behaviours around place, but also an emphasis for myself that began back before the pandemic hit, that begins in where Scotland sits with its health record across Europe, the worst in Western Europe. So that doesn't mean our health isn't improving in Scotland, it is, but the inequality in that health is widening, and something that we've been aware of. But when we're talking about differences in a healthy life expectancy of 22 or 26 years, depending on where you live, that's crucial, and planning has a role in that. And as we shape a new normal coming out of COVID, and we look at planning's part in those conversations, that will be our focus for the week ahead. My name's Irene Beautyman. I'm the 2020 convener for RTPI Scotland. My background is working for the Improvement Service, so we work with local government to help them improve their delivery of Scotland's national outcomes for communities. And I also am delighted to say that I'm seconded to Public Health Scotland at the moment as well. So this relationship between planning, local government, place and well-being and health is part of the raison d'etre of what I do, and therefore I'm delighted to have an opportunity to share this week on what more we could be doing, and to share the experience of what's already happening across Scotland. We're going to do that by having a look at place, the role of place, the fact that every place across Scotland is made up of what we intervene with as planners, that physical intervention and the physical environment, but that we know that has an impact on people, and we know that it intertwines with our economy, how we work, how we invest, how we live. So it's being aware of that. There's a quote that I think sets the scene for our week. And I use it quite a lot, and it's that it comes from a document in 2012, and it's as pertinent today as it was when it was dated then, in Making Healthy Places. And it says, obesity, inactivity, depression and the loss of community has not happened to us. Rather, we legislated, subsidised and planned it. Now, we didn't do that deliberately, by no means at all. We did that with the very best of intentions, aiming to make interventions, doing one thing or another, and this isn't just planners, that's all of us, all sectors in Scotland. We're moving forward to create a better country. But if we don't sit and think about all of a place and all of those characteristics in a place, we can have unintended consequences that are negative. What we want are interventions that give positive consequences of our behaviour. What more can we be doing in Scotland, and what more can planning be doing to be in the room where those conversations are happening? So over this week we will cover those kinds of topics. We'll look at the more kind of generalities above that. What are the collaborations? What's the evidence? What's the impact of health when we create a place? And we'll also drill down into some more of those actual topics. 20-minute neighbourhoods, absolutely brought to the fore. I'm delighted by in this programme for government. The impact of transport, housing, what are all of those elements, and how do they create places where people can thrive? So this morning I'm delighted that we start off with a very high level conversation with leaders in this area, sharing their thoughts and entering into a discussion. Before I hand over to them, I'll just very quick housekeeping is, if you wish to ask a question, please do submit them as quickly as you possibly can, because what I find is that whilst an hour seems like a long time, it really does run away with us very quickly. So please submit any questions into that Q&A box that is on your screen. To begin with today then, I'm delighted that we are joined by the Minister, Kevin Stewart. Now, Kevin's been Minister for Local Government, Housing and Planning since 2016, but prior to that he was also an elected member, a local elected member in Aberdeen. So he's been on that journey with us of the contribution that planning and local government make to creating thriving communities for everybody, not just for those living in those non-deprived areas of Scotland. Following Kevin, we will be passing over to Sue Mans, who's president of the whole of the RTPI in the UK at the moment. And Sue comes with a background, a cross-sector background that I know the Minister would approve of, because he frequently talks about the benefits of us moving between sectors in planning. And at the moment, Sue is working in her own consultancy, promoting that engagement and community consultation in development projects. So the conversations fit together today. It's a fantastic high-level beginning to set the scene for our week. So with that, I shall pass over to the Minister to share his thoughts on how do we embed health into place and that role for planning at this crucial time as we move forward with implementing our planning reform and the focus on our national planning framework as well. Kevin, I shall pass over to you. Thank you.
Thank you, and good morning to everyone. Whilst a virtual event isn't nearly as much fun as being able to meet you all in person, I'm sure we'll have a good chat today. Your programme looks really interesting, and I'm sure that by the end of this week you'll be all inspired to take forward new ideas and opportunities. And firstly, I would like to thank you all for the good work that you have been doing to keep the planning system open for business over the past few months. The pandemic and the need for physical distancing has brought personal and professional challenges for us all. And that's why I'm talking to you from a back bedroom in Middlefield in Aberdeen at this moment in time. You have all shown very clearly that the planning system and the people who work within it can be agile and respond to unprecedented challenges very quickly and effectively. From the outset, we saw not only a health emergency, but an impending economic emergency too. So it was vital that we maintained a pipeline of development to support our recovery. So many thanks to you all for rising to the challenge and for showing that even a pandemic cannot get in the way of planners and the day-to-day business of planning in Scotland. I also want to take time today to briefly update you on some of the priorities in our work programme. Given the events this year, we've had to work out what we can do in the immediate future and what needs to be done in the medium to longer term as part of our commitments. We have learned so much recently about how communities can work together to support one another, and I remain determined that we prioritise the parts of the new Planning Act that helps people to be involved. Our current consultation on improvements to pre-application consultation is just the start of that, and you will hear more about our work on local place plans and mediation over the next few months. Our consultation on short-term lets is also now underway, and I know that it's more of an issue in some parts of the country than others, and that's why we're giving planning authorities the flexibility to manage regulation in their areas alongside our plans for a new licensing system. I'm also prioritising permitted development rights as a key contribution to economic recovery. In our first round of changes, we'll be consulting on widening permitted development that can contribute to a green recovery, active travel and carbon reduction, the agricultural sector, given the impending challenges of Brexit, and better telecommunications, as we have learned so much about the importance of staying connected over the past few months. I'm delighted with the progress we're making towards the digitalisation of planning as a key public service. There is huge potential here as far as I'm concerned, and we will publish our digital strategy for planning in November and follow that early next year with the launch of a 5-year digital transformation programme that will make planning much more inclusive and opening up data that can strengthen collaboration and decisions about positive change for places. And of course, our work on National Planning Framework 4 and all of our longer term work on regulations and guidance are still ongoing. The last 6 months has told us much about ourselves, not only in adjusting to how we do our jobs, but about what matters to us. So let's look forward now, learn the lessons of 2020 and grasp the opportunity of MPF4 and our new planning system to make a real difference to people's lives. Now more than ever, many more people understand that the quality and design of our places can have a major impact on our physical and mental health and well-being. And we've been spending more time in our own areas, travelling less and exploring more of what's right in front of us. This gives Scotland's planners a great opportunity to make a real difference to our people and places in the future, to work with the people who live locally and who are, at the moment, working and spending more of their leisure time locally too. And we recognise that resilient and healthy places rely on social infrastructure as much as physical infrastructure. And that is why we are adopting a place-based approach, and that is extremely important, so that we understand how places can help communities to thrive. And I'm 100% behind the drive for 20-minute neighbourhoods that Irene has already mentioned. Although drive is maybe the wrong term. Walking or cycling or wheeling is maybe the right one rather than drive, so that we can easily and quickly access services which bring huge benefits for our health. Also, huge benefits for the climate and for the pride in the places that we live. There's much for all of us to do to make that a reality, and we'll be looking at how planning can support this in the weeks and months ahead. Our commitment to invest £275 million to support community-led regeneration and town centre revitalisation is part of our place-based investment programme. This programme recognises the need for a coherent and joined-up approach to infrastructure investment that capitalises on the opportunities of a place, building and on our existing physical and social assets. And we're rewriting national planning policy at the same time, and we'll be encouraging people within their communities to capture and share their aspirations for their areas, especially when we introduce the right to prepare local place plans. The new Planning Act is strengthening the arm of planning and communities to not just write plans, but to make them happen. And I hope that in the months ahead that we can make changes to our policies and processes that will leave no doubt that new development has to be properly designed and thought through so that it does more to support health and well-being. And the enhanced status of National Planning Framework 4, which is approved by the Parliament, will mean that planners will be able to pursue these stronger, clearer policies with, I hope, a renewed confidence. 2020 has been a difficult year, there's no doubt about that. But we've learned a lot, the importance of our places and the value of planning. And that may have never been more obvious to society than it is today. So let's keep working together so that planning can do more to improve the health and well-being of people living throughout Scotland. Once again, I thank you for giving me the opportunity to speak to you today, and I look forward to your questions. Thank you.
Setting the context for us for the whole of this week, never mind the conversation at the moment. What I'll do is I will ask the RTPI UK RTPI president if she could style her thinking to add to that context as we move forward and look specifically at how do we embed health into place. Sue, are you there?
Hello, can you hear me?
We can.
Hello, can you hear me? Super. Well, thank you very much for inviting me to join you today. And can I firstly also thank the Minister for his clear recognition and support for the role and the importance of place on people's health and the need to embed this in policy. And I loved the Minister's phrase that he's 100% behind the 20-minute neighbourhood concept, and it's something that's rapidly gaining momentum. So taking a step back, places where people, location and resources combine and create a sense of identity and purpose, and it's at the heart of addressing the needs of and realising the full potential of our communities. So whilst one of public health priorities for Scotland specifically mentions place, planning impacts on all of them. The priorities need local government and spatial planning interventions to succeed. In responding to the Scottish Government's call for ideas on NPF4, RTPI Scotland set out 10 big ideas, some of which are very relevant to integrating planning and health. We need to embed the place and health themes into NPF4 and, as the Minister mentioned, by virtue of its status, into development plans. Embedding health and well-being into the policies of development plans in Scotland offers an opportunity to establish once and for all a consistency of approach and thinking for everyone across the public and the private sector alike, so that we all know what we are delivering. Adopting a collaborative approach to the implementation of the NPF will go a long way towards avoiding those unintended consequences that can sometimes flow from less well-informed decisions. Planning has an important role to play in tackling health inequalities, poverty and inequality by supporting the delivery of homes, services, amenities and infrastructure that improve health and well-being for all. It can provide the vision and the route map to make this happen. The place principle and place standard tool are key to achieving positive outcomes, bringing people together to assess the quality of a place and identify priorities for change, whether they relate to existing or new places. Place-based approaches are fundamental to supporting preventative approaches to health inequalities through, for example, improving the quality of existing homes and neighbourhoods, supporting active and sustainable travel, such as walking and cycling, and improving access to green spaces. Those who know me know that I have a passion for community engagement and the importance of diversity and inclusivity within that engagement. Linked to this is the importance of ensuring that we have the right people around the decision-making table, better reflecting the diversity of the community. Echo chambers of those with similar views do none of us any good. To date, health professionals, with their detailed knowledge of the needs of different groups, in particular those groups who are often missing from community engagement and are often not sat around the table when policies are being developed and decisions are being taken. Or those health professionals are only typically invited to be involved when discussions are taking place, say, around the provision of new health facilities. Place-based decisions that consider the needs of a diverse society are essential if we are to avoid well-meant but poorly informed decisions which fail to consider the full range of public health consequences. National Planning Framework 4 can support planners to tackle health inequalities by supporting the new purpose of planning, prioritising tackling health inequalities, promoting active travel, and embedding the principle of planning decisions that provide long-term positive impacts to prevent persistent problems such as poverty, health inequalities, and climate change, which meet the needs of future generations. It's about hitting that sweet spot, getting that mix of uses, densities, connections, and consequences right. There is a need for planning and public health professionals to be joined at the hip, embedding the place and well-being themes from the place standard and ensuring collaborative implementation of the NPF through the place principles. Skills such as leadership, innovation, collaboration and negotiation are important. And it would also be good to see local health boards working more closely with local planning authorities. Finally, it is vital that planning is adequately resourced to do all this, because the impact of the decisions that we take today will outlast all of us listening to this debate and will affect the health and well-being of the many generations that will follow. Thank you.
Much, Sue. That's fantastic and really sets the scene of where the RTPI sit within this whole conversation and this whole environment and our desires as we move forward and think about those future generations. Like yourself, Sue, I pulled out some real great terms there from the Minister about 100% behind 20-minute neighbourhoods. And strengthening that arm of planning to do more to support health and well-being, all very, very welcome at this point in time. Likewise for yourself, Sue, talking about considering the needs of a diverse community, and that's the absolute nub of it, isn't it, if we're looking at reducing inequality with different needs. And that sweet spot of density, uses and connections, that really pulls it together very well, and I think we'll be looking into those in more detail in the week coming. I have a question about behaviour change that has come in.
Can everyone turn their cameras on? Sorry.
Is that me? Sorry, apologies, you're not being able to see me. I have a question that's come in, but I urge you to submit more questions. But one coming in around behaviour change, and it's been interesting for me. For the past 6 months, we've seen the biggest experiment in behaviour change ever, where we've been under a lockdown in order to make us all change our behaviour with the express intention of preventing us from becoming ill. And that is actually the nub of what we're about. Not being quite as extreme as what has happened to us through lockdown, but actually bringing in interventions that prevent us from becoming ill in the first place, rather than NHS interventions which are about treating us. Public Health Scotland is there to bring that story forward and be looking more long-term in those interventions. And those sit within, the power for a lot of that sits within how people live, work and play in those environments, and so much of that sits in local government, and we'll explore more around that. So the question to both our speakers today though is about, if we're embedding that behaviour change amongst professionals, then what do you think would be the number one change that planners, health practitioners, community planners that are listening in today, what would be the biggest thing? Now, it would be very easy to say we need to talk to each other, so it would be lovely if we could say about what would be that topic, if that is the change. So, Minister, can I go to you first and just ask, what do you think is the biggest behaviour change we need to see, not in our communities, but in our professionals in helping deliver those better outcomes?
Well, I think the key thing for me in all of this is for the professionals actually to get out and about and to listen to communities. I think local place planning will help in that regard. Many folk who are listening today will have heard me talking before about entwining community planning with spatial planning, and that is extremely important. But I think that now is the time more than ever before for us to actually listen to people and hear about their experiences, particularly over the past few months. And I've given the example myself of my own lockdown experiences because I was locked down in Edinburgh for most of the deepest, darkest points of the lockdown, in the small flat that I have in Edinburgh, which has no outdoor space of its own. And I have to be honest and say that when I was out taking my daily exercise, I was envious of those folks who had garden space, or even those folks that had a balcony so that they had their own outside space. And when I got back here eventually to Aberdeen, I was so happy to get back out into the garden. And I think we need to think about these things. And that may not be their own space per se. That there has to be spaces close by that people can utilise without doubt. And that's just one of many things I think that we need to look at. We need to look at place as a whole and how has it operated in your area during the course of the pandemic period, and what can we do to improve on that. So it's basically listen is the key to all of this, and to make sure that we're intertwining all aspects of business, spatial planning and community planning to get this absolutely right.
Thank you, Minister. I totally agree with it. You know, we all have an act already asking that we link up planning and community planning with local development plans to take account of in their vision of the community planning priorities, and that automatically links in with so many of the public health priorities already. So it's set out locally for councils already, and I think that's fantastic. And that those links already being there mean we have that remit to get going on it. Sue, can I ask you to respond to the same question?
Yes, I think the Minister's actually said a lot of what I was going to say. I think you're absolutely spot on about the way that we have experienced lives in different ways, where we've had to live locally, and how we need to reflect on that, but we must keep with us the learning from it. So in the rush to go back to a new normal, we mustn't forget that. But in terms of the number one change, to me, it is back to this diversity of making sure we have got all of the voices around those decision-making tables, and we listen to everyone. Just having a simple tick box, oh, I've had so-and-so from that group, so-and-so from that group, that actually doesn't tell us much, other than we've got a statistic saying we've reached out there. What we've got to do is be inclusive and listen, and I think the Minister picked that up as well. Listen to what is being said and think about it. And then one more thing that follows from that, to me, is act on it. Not just here, it's that tick box. We have to go beyond it. We have to deliver. And it all comes back to just bringing people together. We've seen the very best in communities as they've supported each other. And what is the learning from that? They knew how to reach out very quickly to those that needed help and how to support. So how can we learn? How can we be more inclusive? So that's my response on that one.
Thank you, Sue. We're slightly over time, but as we started a little late, I'm just going to ask one more question. Sue, you mentioned about planning authorities and health boards working more closely together. Minister, I'm aware that last year a letter went out asking that happen a little bit more. So we have a question just asking, what do you think needs to happen to improve that partnership approach then between planners and public health? Any thoughts on that? And I'll go to the Minister. Well, actually, I'll go to you, Sue, and then we'll end with the Minister. That sounds like an apt way to do it. To you, Sue.
Whilst your decisions may be the ones that you've debated around the table, you may be missing, and in particular with regard to health, missing that key input. So some of the hardest to reach groups we have in society, it's very difficult to get them to the table, but the health boards can actually bring that knowledge to the table. So very much back to that theme again. So I'll hand over to Minister, because I think it's probably much more your field.
The letter went out because we recognised the importance of bringing health into planning. And Jean Freeman, the Cabinet Secretary for Health, and I wrote, as you said, to try and ensure that we get more collaboration between not only health boards, but health and social care partnerships and planning authorities. I think even though it's only been a short period since that letter was issued, and even though we've gone through some strange times since with the pandemic, we can already see, I think, folks reacting to that. I've seen a local development plan lately, I think if I remember rightly, from Murray, which showed much more in terms of issues around about health than I think I've seen for a while. One of the main issues, if I remember rightly, was around about dentists. So I think those conversations are taking place. There needs to still be more of them. And as I say, I don't think it's just the health boards per se. It's also health and social care partnerships, because they are the ones who are hearing directly from people. Often the boards are a bit away from people, but the health and social care partnerships themselves are listening to folk on a day-to-day basis on the front line. So it's getting them to give their input. I wonder if I can be a bit naughty, Irene. I know that you're a bit over time, but I noticed that there are questions around about the digital agenda. Can I say that the work that we have done during the past couple of years on the digital agenda was extremely useful during the course of the pandemic period. We used the digital knowledge and the mapping that we have to actually look at what resources were going in across the country to ensure that there were no blank spaces. So what we have done is proven without a doubt that our digital move forward is beneficial not only to planning and planners, but is useful in lots of other ways too. And in answer to Stefano's question, we're going to use as much data as possible to build the tools that we require to deliver for people. We have, even in these difficult times, found the investment of £35 million over the next number of years to carry on with that agenda. I see it as being vitally important, not only for planning and the people that engage with planning, but also good for communities, good for business, and good for government in terms of how we are able to track what is going on right across Scotland.
Thank you, Minister. Just to say it was my error. No, we're keeping going till 5:30. I was having a mind's block there. So thank you for answering around that one. I would totally agree in the work that I've been involved in. The benefits that digital planning can have as we move forward in giving us the evidence, a consistent set of evidence that can inform what planning can do as interventions will be immense as well. So I'm very aware and very grateful for seeing that investment continuing and the desire to really move this forward and help planners in their new asks really around delivering on well-being and that new focus that's coming in through the National Planning Framework. We had another question coming in around a 20-minute neighbourhood, and there's a lot of questions around how do you deliver that in a rural economy. Obviously it is suited, and there's a lot of conversations about is it a 15-minute city, is it a 20-minute neighbourhood. I won't go quite as specific as that. It would be great to get your reflections on a rural population and how it can work there. I think there's important aspects of coming through from Melbourne about the importance of it being, as the Scottish Government has said, a 20-minute neighbourhood, because this isn't just a city issue. This is an issue for every area in Scotland, and in Melbourne it's not where they're bringing in the 20-minute neighbourhood concept. It's because there are so many neighbourhoods across Melbourne, and in those areas that have achieved a 20-minute neighbourhood concept, they have daily walking rates of, and I've written it down, 49 minutes a day people are on average walking. And in the areas that have not achieved it, people are on average walking 7 minutes. Now, it doesn't take any kind of rocket science to figure out the impact that has on physical health, mental health, community development, and so on. So with that thought about what a 20-minute neighbourhood is, how do both of you feel that can be applied when we're thinking about a more rural context? I'll go to Sue first.
I live in a rural area. If I want to go to my local shop, my local co-op, it's a 7-mile walk there and back. So that is an issue in rural areas, and I'm very much aware of it. But where the real advantage to me comes from having that 20-minute neighbourhood is when I do get to that local shop, what other things can I access at the same time? What things can I put together? So if I am going to do that long walk, or if I do drive a short distance to get there, then how does it actually work? And it's then you park the car, then you walk around, then you can actually collect all those things together at one point. And that does then make a difference to the way you live your life. So I do understand fully what they're saying from personal experience, but I think, again, there are lots and lots of advantages, not just for people in cities, but also for rural areas when you start to look at that neighbourhood concept.
And so your reflections on how this is an issue for all of Scotland, not just for our cities.
I think we need to look at it a little bit differently for rural, particularly remote rural and island communities. And Sue is right. Sometimes folk have a wee distance, sometimes a big distance, to access certain services. And what can we actually put in these places to bring lots and lots of services together? But we shouldn't just think about the buildings aspect of this. We also need to look at what is available in a place. And over the past wee while, we have seen how many folk have been volunteering and the services that they are delivering in communities. And, that kind of thing has happened in many of our remote, rural and island communities forever, because it's the only way to make things work. So we shouldn't just be thinking about the buildings, the places. We should also be thinking about who are the people who are helping deliver services and making communities safe and make them thrive, or in some cases just survive. So 20-minute neighbourhoods shouldn't just be about buildings or place per se. We also have to take the people aspect into this as well, and look at what is delivered within that 20-minute area in some of our remote, rural and island communities, and build on it.
Thank you. Yes, completely agree that, and also what Sue's saying, when you get to, perhaps it is a drive when you're in a more rural area, but when you get there, what are the services and amenities that are there to keep you there, rather than driving a further 20 miles to get to some other service or amenity? It's almost like a hub approach of accepting that it can't be applied across very rural areas, but it can still have an application and still reduce our need to travel beyond and go any further than is absolutely necessary. Minister, I wondered if you want to say a little bit more about the role of local place plans in supporting health and well-being, and where they can sit within this context, and then I would pass to Sue after that, because Sue, obviously your expertise is on that engagement and consultation. And Sue, what would be your hope that you would like to see Scotland doing in shaping a bigger role for communities and inputting into that? I'll pass to you, Minister, first.
Thank you, Irene. I think more than ever, we need to have the input of people in order to get things absolutely right. And, listening to people in the communities that I represent, views have changed quite dramatically in some cases around about what they see as important over this past wee while. You know, some people who I think it would be fair to say have objected to many things in the past, now I don't think would be doing so because of the experiences that they've had over the past few months. Some folks who I think it would be fair to say had views around about telecommunications, for example, are now at the opposite end of what they believed before, thinking that we need to move quicker to improve telecommunications in certain areas. So I think we need to listen to what folk have to say. And I think that some of the challenges that we may have had before from people who were constant objectors may have changed because of the experiences that there have been over the past few weeks and months. But again, in all of this, we actually need to constantly communicate with folk about our reasoning for doing these things. Because if we let folk know exactly why certain things are required, then they will shape their place plans around about those things, I'm quite sure. And that's where the community planning aspect of all of this comes into play. Because in community planning, where we're much more adept at listening and taking on board community views, we have always put parameters around about what is possible and what is not. Because if you don't do that, you end up in an area of silliness. And I've given the example of the past of probably my first experience of community planning, bringing a lot of people together some 20 years ago now, where we basically just told folk to stick flags in a map of what they wanted. And you had 3 swimming pools within 4 streets. You know, it's never happening. So we have to set the parameters and then allow folk to have the conversations around about what is right within those parameters. Now, if we do all of that and listen to what folks have to say as well, then I think we can get this absolutely right. We need to mine the knowledge of those folks who have already been involved in community planning and bring them together with the spatial planners and the communities in order for us to get the best possible plans. I know that many folks still see local place plans as a threat. I see it as a massive opportunity, particularly in the place that we find ourselves in at this moment.
Thank you. I'll pass over to Sue.
Again, this is going to sound a bit like an echo chamber, isn't it? I totally agree with what's been said. I think the importance of local place plans is absolutely there. That's where the community feel they can come together. To me, I totally agree. It's about being realistic, about setting the parameters, about enabling the community to make those choices and to balance some of the competing issues. I think trade-offs is something that actually when people understand what they are and they have the information, then they can make an informed sort of view on what is important and what those priorities are. But I think where the difficulty is that where you're talking to people about something that is going to have an immediate impact on their life, that's where you tend to get the objections, because suddenly it's right in front of them and they don't like it because they need a bit of time, like we all do, to think about change. So if you're asking somebody, how would you like, what would you like the change to happen or to be in the next sort of year or so, you'll probably get quite a different response to, well, what sort of place would you like this to be for your children? What sort of environment do you want them to live in? What sort of access to services do you want them to have? So often it's worth starting with that longer term framework and then, right, now we've sorted that out, how are we going to get there? But again, it's all back to making sure that we hear from everybody, because all too often we just get those same people turning up. But if you can be inclusive and bring in different views, and that's where I think our experiences of the pandemic actually stand us in good stead, because we do now understand the unequal impact of it and how people experience the environment in different ways. But if people can hear that from others and form those personal relationships by listening, then that understanding starts to come and people move together. And that is equally a positive outcome from these plans. So it is really about good community engagement that includes everyone.
Thank you, Sue. So many of the conversations I have at the moment are, when we're talking about reallocating space in cities for green space, for whatever purpose, active travel, there can be challenges in convincing people that wish to get in their car. And that's one of those, typical instances of bringing people along. But what we're doing here, though, is addressing the inequalities in our country. And that's why we are taking these interventions. And that's the intended consequence that we have, that we're asking everyone to get behind. That leads on very well to another question that's come in about how do we convince developers then to deliver on the kind of places that are promoting health. So you talked about that sweet spot of getting that mix of the right density, the right type of mix of land uses, and the right connections that creates a sort of a 20-minute neighbourhood. But how do we bring developers online with that? Sue, I'll go to you first and then to the Minister.
Thank you. Having worked in the public sector, the private sector, the voluntary sector, then what I have found that brings everybody together is everyone actually wants to create a good quality place that works for people. Nobody wants to build something that they know isn't going to last. And developers, there is a positive marketing side to this. You create a good community and a good development, and it has a positive effect and it helps you. So every time I've had conversations with developers and you're talking about this, they genuinely want to do the best. But what they actually need is the input to help them do it. So they need that guidance from the public health side. They need it from the planning side. They need it from all these people. Bring them together and help them shape development, should say, because sometimes some of the best ideas are just a little idea that can actually change the way you lay out a place or the way you design it or a connection that you put in. And it may actually be something, and I've seen it happen, where it actually saves money as well, which is a real win-win because you can use that money to improve something else somewhere else on the development. So it is about just getting everybody round that table. We cannot miss anybody out.
I'll pass over to you.
I think one of the key things here is, do they actually want to sell their product? Because if they do, they are going to have to adapt. Because at the end of the day, people are already thinking differently from their experience over the past number of months. And we have seen folks applying to the government for First Home Fund, for example, more folks looking at Help to Buy scheme at this moment because they have been in lockdown for a long while, and a lot of folks' feelings is that the current home that they're in, the place that they're in, didn't work for them during the course of the pandemic. Now, they are not going to move to a place which doesn't work from their experience. So they are going to be looking very closely at what is available in terms of house type and size, and more importantly, I think, layout. They're going to be looking at place, they're going to be looking at broadband connection, and many, many other things. Now, some of these things have come to the fore before the pandemic, but many of them have certainly gone up the list of needs when folk are looking to buy a home. So if developers don't adapt, then they're not going to be able to make money, which is what they need to do to survive. So I think that it's not only a case of us maybe making regulatory change, which will be required, but it's also, if they want to thrive and survive, for them to change their ways and their culture to meet the new needs that people
Thank you.
have.
I wonder within that what role there is for density within that conversation, because certainly work I've been doing with local government and public health has brought that to the fore, that if we want walkable amenities and services, we need a certain sweet spot of density, perhaps not the low density family housing built in a field, but certainly not the high rise that we knew of the past. But a middle point that enables there to be a sufficient critical mass of people to support amenities and services. Is that something you feel comes through from Communities Minister? And then I'll go on to Stu after that.
Well, I think some of the best new places that I've seen in recent times have had mixed tenure and mixed types of housing. I give the example quite regularly of Donside Village within my own constituency, which was a former paper mill site, which was originally brought forward by a housing cooperative who didn't manage to get that through to fruition, taken over by Sanctuary Housing Association, where there's a mix of private, shared ownership, and social and houses for social rent, and there is everything there from semi-detached, not many of those, terraces, but done in an immensely amazing way. Goes back to some of our glorious days of architecture. But within that, there are also flats as well. And, it all works. And the good thing about that community is that part of the original plan was to put a community hydro scheme with an Archimedes screw in the River Don. Obviously, taking it over, the folks didn't have the confidence to bring that forward. So when that dropped out of the plans, the community, if you excuse my language, said, sod it, we're having this anyway, and went and community fundraise, community bonds to create the hydro scheme that was originally envisaged. That community works together immensely, and it is because of the place. The place made it right for people to be able to come together and to do what they want. I'm not saying that everybody fits into that, because that would never be the case. But those are the kind of places which, has all types of housing, all types of people,
Lovely.
and it works.
Thank you. Finally, over to Sue.
I think the combination of community and place, Minister summed up incredibly well. And it is about mixed densities. It's about the right design. I think that came out very strongly, talking about the terrace streets, things like that. The right design, about what we call beauty in design. It's about the way places are laid out. It's about making sure we have the affordable housing element, a truly mixed community with mixed uses. We can, in that sort of community, the 20-minute place that we were talking about starts to come into play, where you've actually designed it in. That has to be the way forward. And you go back sort of many hundreds of years and you look at what sort of small towns and settlements were back in the day. They were that mix of places, mix of design, mix of things coming together. And we can do that now, and we can do it well. And I think the success is evidenced by, as you were saying, the fundraising to support the hydro. That's the benefit that comes from it. You could never have costed that in at the start and said it would happen once the decision had been financially not to do it. But it was the power of place.
Lovely, thank you. Final question that I'll just pop to the Minister, because it's about what we're doing within the Scottish Government reform, so I won't put you on the spot with it, Sue. Is regarding the local place plans. Is there an intention for there to be guidance on preparing those? What are the thoughts on that moving forward?
There will be, of course there will be, and I think, we're not starting from scratch here, because we have seen communities already put forward their own local place plans. Some communities have been doing it for years, and while this may be new in terms of legislation, it's certainly not a new concept at all. And I think that in terms of all of that, we have to be flexible. We don't want to be rigid around about guidance. We want people to come with their own ideas, and we want all of this to flourish. And I think you can strangle things at birth by over-regulating. So, you know, we will be looking at this with a light touch perspective, so that we don't strangle the good ideas at birth, because that's the last thing that we would need. And beyond that, if we were to over-regulate, you know, people themselves would become cynical, and I think would be less likely to participate, and we need that participation. Beyond that, you know, we've talked a lot about local place plans in terms of that community engagement which is required. Again, I think that digital planning itself can expand the amount of folks that engage with planning. And, you know, that's why I've been quite evangelical around about digital planning. I know that some folk are bored with me around about it. Not planners, I would hasten to add. But, you know, this is extremely important in bringing new folk into engaging with planning, because, you know, we all know, I could name you right now the folks who in my constituency are likely to write to me if any new development is proposed, you know, and it's never favourable. And what we actually need to see is particularly younger people engaging with the system, and letting us know what they want, because that is often very, very different from those folks that currently engage normally negatively with the planning system.
A fantastic way to end what has been a great start to a week and set a really good context for us. I thank you, Minister. Thank you, Sue, so much. Big themes there around, yes, 20-minute neighbourhoods, but very much around people, well-being, getting that sweet spot of what that physical impact can have on people and economy, and how the three are all interrelated into a place-based approach, and really what place-based approaches are about. We shall continue on for the rest of the week. We will look into more detail around those, and we will particularly be looking at that, how do we have different practitioners and professionals working together and with communities in order to get this right. Thank you again to both, and stay safe everybody, and thank you for your contributions. Goodbye.